Okay, pulmonary hemorrhage. So we often encounter this in patients who died of motor vehicle accident. Okay, so whatever the cause is, the appearance, the gross appearance of pulmonary hemorrhage is similar. So the lung on the right side is filled up with blood, okay, compared to the left side. And when we do a cross section of it, this is not a normal color of lung. This color of it we can see in a liver. Okay, it's a bit brownish mahogany color. So this is this color. If this color appears in the lung, it shows that there's a lot of hemorrhage that occurs in the lung parenchyma. And this is what we see under the microscope when we take sample from it. All right, so you can see that there's alveolar wall, the one in the blue. Okay, the blue cells are formed by pneumocytes and also infiltrated by inflammatory cells, and the alveolar space in the center, which is filled by the red blood cells. Okay, there's red in color. So this is pulmonary hemorrhage microscopically. So this is a lung from patient who died of vaginal granulomatosis or granulomatosis polyangiitis. So in the lecture, in the video lecture, I did mention a bit about this. Yes, the patient may end up with pulmonary hemorrhage. Okay, the thing about this disease, it has the granuloma. Okay, so on the upper left here, middle left side here, so this is the granuloma formation. Okay, and it can also has central necrosis, Purkinje necrosis. Right. So when we sample this area, so this is what we see under the microscope. So you can see the one in the pink in the center though, that is the granuloma. Okay, so just revise your granuloma. How does it look like under the microscope? And from this lung, if we sample another area, okay, probably somewhere near blood vessels. So this is what will appear. Okay, this is blood vessels, and the lumen is very narrow, and there's a lot of this. You can see there's dark cells in the wall of the blood vessel. Those are the inflammatory cells. Okay, mainly lymphocytes or plasma cells. So when we take samples from the rest of the lung parenchyma, this is what will appear. It's so busy, the alveolar space is filled with blood, and you observe here the darker color cells. These are what we call these are what we call macrophages. And why it looks a bit brownish here, because it engulfs the RBC breakdown of the hemosiderin. So we call these hemosiderin-laden macrophages. So it indicates there is either active or recent hemorrhage that occurs in this tissue.